All right. Hi, everyone. Welcome to our training this afternoon. My name is Iris Wen. My pronouns are she, her, hers, and I am the FRC training coordinator. We are super excited to have Jayashree Nathaniel from Golden Gate Regional Center here with us today to talk about regional center services. So we'll be learning more about Early Start and the Lanterman Act. Next slide, please. First, we just want to briefly talk about what the FRC does here in San Mateo County. We serve families who have children with disabilities or special needs between the ages 0 to 22, and we are staffed by parents and caregivers of children and young adults with disabilities. We provide support, information, resources, and referrals to navigate the systems out there. We offer trainings like this one, support groups, a resource binder, and a monthly e-newsletter. I want to give a disclaimer that the FRC is not a legal firm or legal services agency, and we cannot provide any legal advice. Any information provided by the FRC should not be considered a means of taking the place of legal advice that must be obtained through an attorney. We invite you all to connect with us, and I'll put our contact information in the chat. I also want to introduce our FRC team who is here with us this afternoon. We have Patricia Idrugo, FRC Supervisor, and Denise Tinoco, FRC Bilingual Coordinator. Next slide, please. Next, we just want to go over some general housekeeping items to make sure that our training runs smoothly. As I mentioned, we will be recording tonight or this afternoon's training for any families and providers who are not able to attend. So we ask that you please mute yourself when not speaking to avoid any background noise. We are also offering simultaneous interpretation in Spanish today. So if you haven't already, you can select the language that you would like to listen to this presentation in. In the settings bar under the globe icon, you can choose either English or Spanish. We ask that if you're listening in English, please select English in the settings, and this will allow you to hear the interpreter translate from Spanish to English. We have enabled live automated captions. So if you would like to view the captions, go to your Zoom settings bar and find the icon that says CC and then click to show captions. We will have a Q&A portion at the end of the training. So please save your questions for the end. We encourage you to write them down as they come up so you don't forget them. You can use the chat box or raised hand feature for any questions and comments. We encourage you to refrain from sharing any names or detailed information to protect your privacy and others' families' privacies. And after you ask a question, please be mindful of making some pauses to allow our interpreters enough time to translate both the question and answer. At the end of the training, we will be distributing a survey both in English and Spanish to collect your feedback on how the training went. It will be anonymous and will help us understand how to improve our trainings for you all. And last, we will be sending out a follow-up email with the materials from this training tomorrow. Okay, and now I'll turn it over to Jayashree. Thank you, everyone.
All right, thank you very much, Iris. And I am Jayashree Nathaniel, as you all heard. I am the manager for Regional Center Services in GGRC San Mateo County. And I am very thankful to the FRC team for inviting me to speak about Regional Center Services and hoping to answer any questions you all might have. So as you may be aware, and if you're not, Golden Gate Regional Center is one of the 21 regional centers within the state. And we are supporting lives of liberty and opportunity in the 3 counties of San Mateo, San Francisco, and Marin County. And we can go to the next slide.
Yeah, Shari, just want to be sure that maybe, I don't know if you can approach a little bit more your microphone, or if you can maybe raise the volume. I think it's a little bit low.
Oh, okay.
Thank you.
How is this? Is this better?
Yes.
Okay, perfect. Sorry about that, everybody. So hopefully you can hear me. And Yeah, so as I mentioned, Golden Gate Regional Center is one of the 21 regional centers that are there within the state of California, and all regional centers are state and federally funded nonprofit organizations. And we are here to serve individuals with developmental disabilities. So the regional center was initially established in California through legislation and primarily by our state assembly member, Frank D. Lanterman. And Golden Gate Regional Center was actually one of the first two regional centers to be established within the state, and the other regional center was the Frank D. Lanterman Regional Center in Los Angeles County. So Golden Gate Regional Center specifically serves the three counties that I mentioned, and we are to provide services to individuals with developmental disability. Formerly, they were also referred to as mental retardation, but since then that terminology is no longer used, and we use this term intellectual disability instead. We can go to the next slide. So regional centers are charged with serving individuals throughout their life, and that includes kids that are in the 0 to 3-year-old age range. And I just wanted to give a little bit of a background on the Early Start as well. That initially the Early Start program actually is a state and federal program. And since the regional centers were already in existence providing services to individuals with developmental disabilities, it was decided and it made sense to house the Early Start program within the regional center in itself. So the Early Start program is, their criteria is slightly different from the Lanterman services, and therefore I will go over briefly the Early Start program and then the transition into Lanterman and the Lanterman services. You can go to the next slide. We can go to the next slide.
This would be slide 7, yes. This is the slide.
Thank you very much. So how does Early Start program work? I'm first talking about our Early Start program that is for individuals from birth through 3 years old. So individuals, in order to be assessed and provided services for Early Start, they have to be residents of the counties that the Golden Gate Regional Center serves. So that would be San Francisco, San Mateo, or Marin counties. And eligibility, this also applies to Lanterman services. And eligibility for regional center services is not based on income, legal status, or insurance. And it is also important to remember that our services are voluntary. So a person or a legal guardian must want our services in order for us to be able to provide those services. And at any point, you can also decline to choose a specific service. So that is something that our regional center social workers will always check in with you as the parent, with you as the family member, with you as the individual served, to ensure that you do want a particular service and you do give consent to that. You can go to the next slide. The next slide, please. Oh, thank you.
This
You
is
got it.
fine.
Yeah, I think there's a little lag. Thank you very much. So the other thing, and this applies to all early start as well as Lanterman services, is that we have bilingual staff within the regional center. So Golden Gate Regional Center employs bilingual Spanish, Tagalog, Chinese. We also have Arabic speaking social workers and to work with our families, to work with those of you for whom English is not the primary language. And then if there is another language that we might not have staff available for, we are able to make arrangements as needed for translators as well. So that we can have proper communication. So you can always request that if you are feeling as a parent, as a provider, as a individual serve that you are not able to communicate with the GGRC staff, you can always request for an arrangement to be made in that regard. Next slide, please. All right, now we are going to dive into the Early Start program. So I'll give you a little bit of information on how to access our Early Start program. You can go to the next slide and the next slide. Perfect, thank you. What are the steps if in order to see if your child is eligible for early start services? What are the steps? The steps are, there are a few steps, and the first step is the referral. So in order for us to be able to um, in order for us to be able to provide services, it is essential that we receive a referral. And that is where the first step is in order for our services, for our assessment to take place. And so with that, what happened, in the end, you will receive the contact information for our referrals, and anybody can make a referral. So it could be a family member, it could be your child's doctor, it could be teachers, it could be anybody in the community that can call and make a referral for somebody if you feel that they could be eligible for regional center services. If they could benefit from regional center services, then you can call and make that referral. So the referral is the first step in the process. And once we receive a referral, then after that, the early start service coordinator for intake. So we have an intake specialist who will contact you, or who will contact the person, whoever made the referral, to get more information, to maybe ask questions, and to ask if there's anyone else who knows about the child's development. So it could be anybody else that sees the child, or the family members. Maybe if the child's doctor is not making the referral, maybe the child's doctor is the person we want to talk to. Maybe there's other teachers, maybe other people involved that we would need information for. And this information is then used. So the intake specialist collects all the information that they would need on the child. And once they have that, then after that it goes into an assessment. So that's where the assessment would meet, the assessment team would meet, and see if the child meets all the criteria for eligibility, and if the child is eligible or not. So with that process, and again, I just want to go back to the referral. If a referral is made for a child by anybody who's not the parent, then our intake specialists would definitely want to circle back to the parent of the child, or whoever's the legal guardian, and get the consent. Because again, it's important to remember our services are voluntary, and as such, we would need consents every step of the way to make sure that we have agreement in order to proceed with our services. So once the consent is received, the information for eligibility is received by the intake specialist, then it goes to assessment, where the assessment takes place with all the information, with meeting the child, with speaking with you as a parent, to determine if the criteria are met for early start program. And once the assessment is completed, and if the child is made eligible, then it goes to the other steps that follow that. So I will go into those steps in further detail in a little bit. Can we go to the next slide? So as I mentioned previously, the referral is made by calling our number, and you will receive this number. It is in our last slide, and you can make a note of that if you don't have that already. And I mentioned about the intake specialist completing the intake screening. So that's when they're asking all the questions. That's where they're seeking all the documentation that they would need in order to be able to fully assess. And we can go to the next slide. So once, as I mentioned, once the referral process is completed, the intake is completed, then it goes for assessment. And this would be helpful for you to remember. Eligibility must be completed within 45 days of the receipt of a completed referral. So if you're not seeing that happen in your case, you can always reach out, and you could always have a conversation about that. You could also appeal that if you're not seeing that happen. So I just wanted to mention that for your information. Can we go to the next slide? So what are the criteria for a child to be eligible for early start services? And infants and toddlers from birth through the age of 36 months would be eligible for early intervention services if there is documentation and assessment, they meet one of the criteria. So there's developmental delay, there's established risk, and there is a high risk category. We can go to the next slide. So what is the developmental delay? Now, a developmental delay exists if there is a delay. So there is a delay in one or more of these areas. There could be a cognitive delay, a physical delay, communication, social or emotional or adaptive. So it has to be one or more of the following developmental areas, and it has to be a delay of 25% or more in these areas in the level of function. Can we go to the next slide? And so then the second category was the established risk for developmental disability. Now, there are some established risk conditions, and these could be diagnosed by qualified personnel and an interdisciplinary team, which includes the parents. So the condition should be certified as a high probability of leading to a developmental delay if the delay is not evident. So, so this is another category that we have. And if your child falls under this, then they could still be eligible for our early start services. Can we go to the next slide, please? So Down syndrome is just one of the examples of criteria to be met. Can we go to the next slide? And then finally, we have the high risk category. So in this category, two or more of the following need to be met. So as you can see, I think is the slide very small? Can people read it? Maybe we can zoom in a little bit.
I'm not sure there's a way to zoom in on
Okay,
the presentation.
no
Sorry.
problem. No problem. I think people will be able to get
A
a copy
copy,
of it. So
correct.
yeah, they can look at it. Okay, no problem. So yeah, just speaking a little bit to the high risk category, there has to be at least two or more of the following. So there, as you can see, there's a lot of things listed here, which includes assisted ventilation. There is central nervous system abnormalities, there's hypertonia, prenatal substance exposure, severe metabolic abnormality, or there could be that a child or infant or a toddler is a child of somebody who has a developmental disability and therefore requires these intervention services. So this is the third area that would meet the eligibility for early start services. We can go to the next slide. So a developmental delay for the purposes of early start program is not determined just based on a temporary physical disability. Cultural economic factors, the normal process of second language acquisition, and manifestation or dialect and sociolinguistic variance. So it's just something to keep in mind that, you know, when you have concerns about your child or when you have concern about a child, an infant or a toddler, that some of these things could also be in play. And when our intake specialist and our assessment team is going through all the documentation and meeting with you all and talking about your child with you all, they're also considering that is it just this or there is more, and therefore they would be eligible for regional center services. We can go to the next slide. So then, you know, after what happens in the assessment, who is part of the assessment, who assesses your child for regional center services? Now, the GGRC social worker, the assessment social worker, plays a crucial role in that. So once the intake has completed, the intake specialist submits everything to the assessment social worker. So it goes from our intake team to assessment team. And these are different teams. So there are assessment social workers who are specialized to help with this process of assessment. They will get together whoever else they think is needed in a particular assessment. And this could include a speech and language pathologist, GGRC physician, GGRC psychologist, GGRC early start nurse, or any other professionals. And of course, you as family members, you as caring for the child, knowing the child would also be included in that assessment process. So I just wanted to give you a little bit of an idea of what that team comprises of that comes together. And this is also an opportunity. And throughout this process, you know, if you have questions on certain things of why something is needed, some information is needed, or why some information is not relevant, you can always ask that. So initially, if your child is in the intake phase, then you would ask those questions from the intake specialist. Once it has gone to the assessment team, then you can ask those questions from the GGRC assessment social worker. So if a child is found eligible for early start services after this assessment is completed, then the first step is to develop an individualized family service plan. Once you have reached that phase, or if you have crossed that phase, you probably have heard it referred to as IFSP as well. So that's what it stands for, Individualized Family Service Plan. We can go to the next slide. And the next slide. Thank you. So what is the individualized family service plan? Now, this is developed with the family based on the child's and family's assessed strengths and needs. So it is a meeting where once your child is made eligible, then you get assigned to an early start social worker. And this individualized family service plan is something that's developed with your early start social worker. So, it would address what are the outcomes, what are the needs of the infant or toddler, what is the family, you as the family, you as the circle of support for the toddler or the infant, what do you want to see as an outcome? So all of those outcomes, all of those goals are addressed in this plan. And the services that get funded by the regional center are all based on those goals, on those outcomes. So if there is an outcome, how can our services help to achieve that goal? So it is very important to share at the time of the individualized family service plan development meeting, where do you want to see your child? What do you want your child to achieve, maybe in the next 6 months, in the next year? And also, it is important that you invite others that you think would have good feedback to give to the early start social worker in terms of what would be helpful for your child. So service planning also occurs to support the developmental outcomes. So as I mentioned, the services are then linked with those outcomes and those goals that the infant or the toddler we are hoping would be able to achieve. We can go to the next slide. So services for early start are provided in the natural environment whenever possible, and this is as per the regulations, and it is as per section 303.26, talking about natural environments. These are settings that are natural or typical for a similar aged infant or toddler who would not have a disability. So normally, if we think of these, what are some of the areas? So that would be like everyday routines, relationships, activities they would do, where all they would go. Those are all seen as natural environments. So once the child is eligible, the early start social worker reviews the child's progress every 6 months. And or as needed. If something is needed sooner, then you definitely want to reach out to your early start social worker and request for a meeting. Otherwise, the social worker would meet with you every 6 months and complete the IFSP meetings. The IFSP's meetings can be held at your family home, or it could be at the child's program to include the team if that is necessary. We can go to the next slide. So by law, early start services is from birth through age 36 months, so 3 years. So on the child's third birthday, they are no longer eligible for early starts services, because this is by law. It has to end on the child's third birthday when they turn 36 months. That date, that month, that year, those services stop. So we'll talk in a minute what happens after that, or what happens before then in order to prep for that. So we'll talk about that in a little bit. At each of the IFSP meetings, the progress of the child is reviewed. So if a child has made significant progress, the child may not require early intervention services and may graduate early. So that could be a good thing for our child. Or if you feel that no, your child needs more services, they need more intervention, then that would be a conversation to have at the IFSP meetings. And these are held every 6 months, or it could be held even sooner than that. So you definitely want to make sure you give your feedback, so then we have heard that, and the social worker is able to act on that accordingly. the parents are the key members for the IFSP team because you or the legal guardians because you know your child best. You know um, how they're doing, how they're progressing. So definitely the key members of that IFSP team is the parents and of course the GGRC early start social worker and the parents caregivers participation in programming is mandatory. So that is required. We can go to the next slide. Thank you so much. So what we talked about early start services. So once the child is made eligible, the plan has been developed. Now what? What are some of the things that most common services that the regional centers are able to fund for, pay for in early start? So we have a variety. And again, you know, our services are based on the needs of the child, needs of the infant, needs of the toddler, needs of the family. So they could be unique, and therefore it might not be limited to this, but there is a list on the slide, which includes assistive technology, behavior therapy, family training, health services, nursing services, vision, OT, PT, and there is a lot of services listed there. So again, you know, the key is to remember and approach it this way, that what is it that my child, my infant, my toddler needs? What is it that I need to help my infant and my toddler achieve their outcomes? And that's what you want to let the GGRC early start social worker know, so they can figure out what all services can be provided to help you with that, to help your infant and toddler with that. Now, some things to remember when talking about services. Evaluations, when we are doing our assessments, they are no cost to the family. Regional centers are payers of last resort, and this is as per regulations. Now, there is a fee requirement for selected services through the annual family program fee, or there is a family cost participation program based on family income that applies to certain services. So if you would like to know if this applies in your case to the services that you're requesting, you might want to ask that from your GGRC social worker. Parents are also required to use their private insurance first for services such as behavioral health treatment, speech therapy, OT, feeding, physical therapy. Now, this is where, when I mentioned that regional centers are pairs of last resort, this is what it means. So last resort means that we come in last, our funding comes in last. If there is insurance, private insurance pays for something, then, you know, that becomes the first resort. Regional center would be the second resort in that. If there is any other, for infants and toddlers, I think insurance is the biggest piece. If insurance is not paying for something and there is no other resort, then regional centers are pairs of last resort. That's where we come in. So that's something to keep in mind. So I mentioned a few slides back that early start program has to end by law when a child turns 3 years old on their third birthday. So what happens after that, right? So in order to plan for what happens after that, the early start social worker starts working with our families much before then. So when your child is around the age of 2 years and 6 months, then the early start social worker will start talking to you about transitions. And what happens, what is the biggest transition? Well, I'll not jump ahead of myself. Let me go through the slides. So the IFST team may have a transition meeting. So as a part of discussing that transition process for your child, there may be a transition meeting scheduled. And this happens like a good 4 months, at least good 4 months before, if not even before then. And there's the conversation that comes in terms of what would happen next once the child turns 3, and if they still need regional center support, what happens? If they still need support in certain areas, what happens then? So there's a few things that the early start social worker at that point, or our transition specialist at that point, would get together with you as the parent and talk about. One of those transitions would be transition into the school system. So that is a huge transition, and regional center staff always help families with that, helping you with making the referrals, what that looks like, who to reach out to, how to go about that. So that is one transition. The other transition within the regional center is going to the next program. So early start program that I've been talking to you all about so far goes from birth through 3 years old. Now at 3 years old and over is the Lanterman services. So I will talk about that next. So our program, Lanterman services, that provides services to individuals that are 3 years and older, is what at that point the early start social worker will also start talking with you and discussing, would your child be eligible for regional center services after they are 3 years old, also referred to as Lanterman services, ongoing services. So that's the other conversation. And again, we'll go through the process of that. It's a little similar to how the early start, initially the intake assessment is, and it's a similar process that would take place to determine eligibility for ongoing services after that. So transition planning will also include community resource. So I mentioned about the school referral that would take place. There are other programs as well, such as Head Start, or there might be other programs in the community that the early start social worker may connect you all with as well during that transition period to help. We can go to the next slide. So as I mentioned, your child may also get assessed for regional centers ongoing services through the Lanterman Act. So it's also referred, services after 3-year-old is referred to as the Lanterman services, also referred to as ongoing services. So if you hear those terminologies, that is what it means. So at 3 years of age, a child will graduate from early start completely. The day the child turns 3, by law, they are graduated from early start, and they may be eligible for ongoing regional center services through Lanterman. They would be eligible for special education services through the school district. So many of the services that early start, regional center early start may have been funding for your child, such as speech therapy, occupational therapy, would now be something that the school would take over. And there are certain situations where it might not be so, but generally that is how it is, and the school is there. Our early start social worker is there to help you through that process. So I just wanted you to know that, please, this could be a big transition. Transition could be stressful. It could be a big unknown for you, but I just want you to know that the early start social worker, the transition specialist, we are all here to help you through that process. So you can always ask your questions from them. We can go to the next slide. All right, so is that the next slide? Okay, so there are some low incident conditions, such as Did we miss a slide? I'm just curious. I feel like, can we go to the slide before this? Well, you didn't. No, you're fine. So yeah, this slide seems a little odd spaced here, but anyways, I'll address it now. So there may be some instances where your child has hearing impairments, there are vision impairments, orthopedic impairments, or any combination of thereof. And just solely these incidents, impairments do not qualify for regional center services. So the early start social worker, the transition social worker will connect you or will inform you to contact the educational program, that's the school district in your county. And these are impairments that the school would be able to assist with. So, so just based on these low incidences conditions, they don't qualify as such for regional center services. And we'll go over the criteria for Lanterman services in a few slides. We can go to the next slide. So here's a little bit about family resource centers. I'm sure you all are aware of the Family Resource Center. We have a great family resource center within our San Mateo County, and you can reach out to them also with help to help with any of these transitions or any of these services, any of these programs. We work collaboratively, and they are able to help you, guide you if you feel like you need that more support, or just, just to have that support. So please do reach out to our family resource centers as well through any of this process. Thank you. Next slide, please. All right, so now we are going to talk about Lanterman services. As I mentioned, this is services, Lanterman or ongoing services is for 3 years old and over. So when I say over, it goes through end of life. So anybody 3-year-old and over, any age, could be eligible for Lanterman or ongoing services at the regional center. You can go to the next slide. All right. So as I had mentioned in the beginning with the early start services, similar to that, when we need to assess somebody for regional center, if a child is over 3 years of age, then they need to go through steps. So again, once your infant or toddler turns 2 years and 6 months, the early start social worker already starts with these steps. So if they think that your child may be eligible for regional center services after the age of 3, they would have already made a referral. They would have already helped you with the intake, told you about the eligibility criteria, and there would be an assessment somewhere close to your child turning 3 years to make sure whether your child is eligible for ongoing services. So in those scenarios, what happens is we try within our regional center, we work very closely with our early start unit and the ongoing units, work closely to make sure if there is a service that you need, that there would not be a gap. So as soon as your child turns 3, the ongoing services can come in and start funding if something is needed. And therefore, all the planning starts much prior. So if somebody is not connected with our early start program, and say, for instance, your child is 3 years old, or you as a provider in the community, be it the school district or be it anybody else, if you see a child not connected with the regional center and they are 3 years of age or older, any age after 3, then we go through those steps again because they're not already with us. So we need to have a referral. So somebody needs to make the referral. Parents can make the referral, primary care doctors can make the referral. Can make the referral. And anybody in the community can make a referral. Family member can make a referral. So anybody, if the child is a minor, and then we would need to go back to the parents and get the consents, or from the legal guardian get the consent. Again, to remember is that regional center services are voluntary, and as such, we need your consent to make sure that you do want these services. And that would be something that the social workers will always come back to you. If it's a new service, if it's for eligibility, any scenarios, we would need to have those consents from you. So once the referral has come in, then it gets assigned to an intake specialist, and the intake specialist's role is to make sure that we have all the information we need, just like with Early Start, making sure we have the documents, all the records showing the progress of the child, whatever else would be needed. So the intake specialist will make sure once the intake is completed, they might come back and ask you some questions as well. Once that is completed, then from intake team, it goes to the assessment team. And the assessment team will then, assign an assessment social worker, and that assessment social worker will be your point of contact. So they will be scheduling an assessment. And after that assessment is done, similar to like in the Early Start program, it would be decided if your child, if your adult individual meets the criteria for ongoing services. And once they are made eligible, if they're made eligible, they meet criteria, then they get assigned to a regular social worker and an ongoing social worker. And I will go into the steps after that. We can go to the next slide. So with the referral and intake, it's very similar to what I mentioned when I was talking about the Early Start program. A referral can, if your child is already with the regional center, then it would automatically be done by the Early Start social worker, by the transition specialist. But if your child is not connected with the regional center yet, and they are 3 years of age or over, so it could be any age, then a referral can be made by calling, faxing, emailing, and you'll have all that various contact information at the end of this presentation. So the intake specialist gets together, gets all the information, and then it again, I mentioned about the consent. So if we are not able to initiate a contact, then we would need to get a signed release from the applicant. Now, if the applicant is over the age of 18, so if they are an adult, then we would need their consent. So if you, as a parent of somebody who's over the age of 18 or over the age of 18, are calling to make a referral, please know if you do not have conservatorship, then we would still need that consent from your individual. But again, we will work with you on that. So we will explain all that to you. Now, once the referral, the intake is done, you will get brochures, you'll get information on application form that you would have to fill out. And then there is a home visit as well that the assessment social worker will do as a part of the eligibility. We can go to the next slide. So what does eligibility for Lanterman services really looks like? Now, we talked about the three criteria when we are talking about Early Start eligibility. The eligibility for Lanterman is different. There's different criteria. They're not the same as the Early Start eligibility criteria. So according to Lanterman legislation, a person is eligible for regional center services if they have a disability, which meets all of the following criteria. Now, what are these criteria? So the first one has has four sub criteria. So from the first category, an individual can have one or more. So what is the first criteria? So the disability could be due to an intellectual disability, and individuals with intellectual disability have IQ scores that are approximately 2 standard deviations. So typically IQ of 70 or less. So that's the first, under the first criteria. Then there is cerebral palsy, which is a neurological disorder, and it affects the body movement and the muscle coordination. Then we can go to the next slide. Then the other three under the first category are epilepsy, which is again a neurological condition, and the person would have repeated seizures over time. The next criteria is autism, again a neurological disorder, which is characterized by social impairments. There would be communication difficulties. The last but not the least is having a condition that's closely related to intellectual disability or requires treatment, which is similar to that required for individuals that have an intellectual disability. So the first criteria for regional center ongoing services includes these 5 broad areas, and your child or your adult child could meet one or more of these 5, but they have to have at least one of these 5. Now we go to the next, the second criteria. So the disability originates prior to the age of 18. And why this is so? Because regional center services are provided for individuals that have a developmental disability. So it's important to remember it's developmental, and generally prior to the age of 18, the development has, most of the development has occurred. So the disability originates prior to the age of 18. That is very crucial, and sometimes the assessment social worker or the intake social worker would try to find documentation that would show that this happened, the disability originated prior to the age of 18. The disability is likely to continue indefinitely. So it's likely to remain long-term, and therefore these supports are needed, these services are needed. And generally, when we have somebody eligible for regional center services, they're generally eligible for regional center services throughout their life because they need that support. So the fourth criteria is that disability constitutes a substantial disability. So what does substantial disability mean? It means that, those limitations in 3 or more areas of life activity. There's self-care, receptive, expressive, learning, mobility, self-direction, independent living. So in any of those, at least there is a limitation in 3 or more of these areas, which shows that it is a substantial disability. Now, additionally, individuals at risk of having a child with a developmental disability may be eligible for other preventive services as well. So in order for somebody to be eligible for ongoing Lanterman Regional Center services, they have to meet all 4 of these criteria. The first criteria had 5 different areas, so they have to meet at least one of those. But then 2, 3, and 4 combined together, they all have to be present. We can go to the next slide. Now, in 2021, there was another category added to the eligibility criteria, and that's called provisional eligibility. And this is for children 3 and 4 years of age. And this is a criteria that is the disability is not solely physical in nature. The child has limitations in at least, so the child has to have limitation at least two of the following criteria that could be self-care, language, learning, mobility, self-direction. If they meet this criteria, so when the assessment social worker, the assessment team is assessing if your child meets regional center Lanterman services criteria, they're also looking at this. If they don't meet any of those criteria that I went over in the previous slide, then they would automatically review to see, does your child meet criteria for provisional eligibility? Now, one thing to remember is that this only applies to children 3 and 4 years of age. So if your child is in that age, they're not meeting the other criteria yet, your child could be made eligible for provisional eligibility regional center services. So a child who is provisionally eligible is reassessed at least 90 days before they're going to turn 5. So those criteria that I mentioned previously would come back, would be something that the team would look at when your child is turning 5 years of age. Now, with provisional eligibility, one thing to remember is that if your child is made eligible for regional center services under this criteria, provisional eligibility criteria, they're eligible for all services as would any child with meeting all the criteria for regional center services. So there is, I just want you to know that there is no difference if your child is made eligible under this criteria with those that are made eligible for regional center services, even though this is a provisional criteria, but you have access to all the services that normally somebody would have. Next slide, please. So yeah, going back a little bit, once the referral intake specialist has everything, they hand it over to the assessment social worker, and I think I've gone over this already. So we would go to the next slide, please. So then the assessment takes place, and again, you know, the regional center assessment social worker will determine who all needs to be included. GGRC physician, psychologist, assessment social worker, of course, is a part of the team. And then, you know, the team may conduct further medical, psychological evaluations if needed. So, you know, trying very hard to see, you know, not ruling out everything, making sure that we have done everything to see if your child would be eligible. Now the assessment social worker has 120 days to complete the eligibility from the day that they receive everything from the intake specialist. So I just wanted you to have that timeline in your mind. Again, if you think that it's not being met, it's been way more than that, you can appeal that decision. You can reach out to us, and you have a way to voice that. We can go to the next slide. So assuming that your child, your adult child has been made eligible, found eligible under one of the criteria that we talked about, what is the next step? So the next step is that we assign an ongoing social worker, a Lanterman social worker, to your child, to your adult family member. And the first thing, as we talked about with Early Start, the first thing is to document what are the goals, what are the objectives, what are the needs that we need to focus on as a team. And so as with Early Start, it's referred to as the IFSP. For ongoing services, we refer to it as the person-centered plan, also known as the IPP, individualized person-centered plan. And this is where the ongoing social worker who gets assigned to your child, to your adult family member, will then meet with you, will meet with whoever needs to be a part of the team, and focus on what are the strengths, what are the needs, What are the goals? What does the person want to achieve? What you as parents of the child want to see your child being able to do, and those would be documented in this plan. Now, at Golden Gate Regional Center, we do our IPPs, or person-centered plans, once every 3 years. So when you are doing the IPP, you want to think of goals for your child, for your adult family member for 3 years. Where do you want to see your child? In between those 3 years, our social workers will also do annual check-ins. So at least once a year, they will be meeting with you. But if you need more than that, if you think you just met with your social worker a month ago and now something has changed, a service is not working out, or you want to talk about a different service, or there is a concern, then you want to call your GGRC social worker right away. Do not wait for the next year to address that, because our social workers are available throughout the year to help you as needed. But if they don't hear of anything needed, then generally they'll check in with you annually. And once every 3 years, there'll be a person-centered plan that would be completed. And you would receive a copy of that once the social worker has written that up. And if you don't have it, you can request for that. You can go to. So the IPP, as I mentioned, it documents all the long-term goals and outcomes, and what are the steps that are needed to achieve those. So short-term objectives, and it will also document who is going to do what. Now, again, important to remember, regional centers are pairs of last resort. So social workers will be asking you questions because they're trying to see what generics might be there. At this age, a child is usually in school, and usually our individuals that are with the regional center stay in school through the age of 22, unless they have a high school diploma prior to that. So is the school something that should be funding a certain service or support? Is the insurance, medical insurance, another resource, a generic resource? So if there is no resource and the person needs a service and a support, then regional centers are pairs of last resort. So that is something that you want to discuss with your social worker. They should be able to guide you to generic resources, help you with that, make referrals if needed, to IHSS, maybe to CCS, maybe school districts, any of these. And then if your child does not have Medi-Cal, we have a program, a deeming program for children that is eligible, that you can apply for Medi-Cal through. So that is something available through the regional center. Of course, your social worker can guide you with all these services. I just wanted to mention some of those. We can go to the next slide. So what are these objectives focusing on? The individual program plan, or the IPP, is divided into sections. And if some of you already have an IPP for your family member, you've seen it. The social workers talk about the health and well-being. How is that going? How are things at home? Is there additional support needed? And then we talk about the work day or school. So if they're in school, how's school going? If they've graduated from school, if they have a certificate of completion from the school, then we have a variety of programs available after that. Transportation and anything else. So again, an individual, you as family member, can invite anybody you think would have helpful contributions at the IPP meeting. So the individual GGRC social worker and other team members meet at least annually or more to check in and see how things are going from there on. And yes, of course, the IPP or the person-centered plan is created every 3 years. But you can request if there is a need to have an IPP meeting sooner, you can contact your social worker for that. We can go to the next slide. So what are some of the things that ongoing regional center services can fund? Now, again, there is a variety, as you can see on the list, there's a variety of services, and this is not an exhaustive list. But I think it's important to remember, and your social worker will always try to ask you as well. You want to see your child's or your adult family members, what is the need? What is not working out for you as a family with the current situation? And then you want to share that with your social worker. So then the social worker is able to connect you with the appropriate service. So is it going to be respite service? Is it going to be daycare? Or is ILS going to be able to independent living skills training going to help? Or does your child need behavior intervention? So they'll be able to then pinpoint what that service is that would be helpful. So always, try to see what's not working out, what you think would be helpful, what's some area that has been overlooked, there is a gap that would be helpful for your child, for your adult member to have, and you want to let the social worker know that so we can address that. Then the social worker will assess really and see, is there a generic? Is this something we're able to fund or direct you? And accordingly, they'll follow up on that. So I just wanted to share that. We can go to the next slide. So this is a continuation of what are some of our services. Respite services is one of our most popular service, as family members, you're taking care, those that are family members here on this presentation, and you have somebody with the regional center, you know how difficult it is, and we understand. So respite gives you that break, and then there are a variety of other services as well. We do help making referrals. We work very closely with Department of Rehabilitation. So if somebody is interested in getting a job, we can help make those referrals as well. So again, whatever is needed, we want to address that and see the best way to do about that. Now, something to remember, as I mentioned, with Early Start, there may be a fee requirement for selected services. So the Department of Developmental Services that oversees all the regional center, the State Department, has two programs, the annual family program fee and the family cost participation program. And this applies to certain age group, mostly children. Those do not have Medi-Cal, and these fees might apply. So your social worker will guide you through that if it does apply, and let you know about that, share brochures with you on these programs. So you'll have that information as well. We can go to the next slide. So as I've been saying a few times, here's all the contact information for the referrals. So referrals can be sent in. You can make a telephone referral, and then you'll get the form to fill out and all that. After that, referrals can be faxed in. There is email for our intake, and there's more information on our referral process and all of the processes on our website. So you can also go into our website, and then you can select the tab from the top that says services, and it'll guide you through the referral and intake and assessment and all of those processes. We can go to the next slide. And that's the contact information for Golden Gate Regional Center, our 3 offices. As I mentioned, we are covering San Mateo County, San Francisco County, and Marin counties. And you will find the phone numbers and addresses for all 3 of our offices. But if you're attending today, you're residing in San Mateo County, then you want to contact the San Mateo County phone and fax and the address if you want to drop by. We recently moved last October, And our new address, we are located on South Norfolk, easily accessible by public transportation. There's a lot of parking if you drive. But yeah, so you can definitely, I would encourage you, if you are in any point, if you have lost the contact information for your GGRC social worker, or if you're not sure who your GGRC social worker is, or you want to make a referral, you've never spoken with anybody at the regional center, then you want to call that telephone number that's listed under the San Mateo County office, and our wonderful people at our front desk will guide you with what information you need. So, and I believe that's the last slide. Yes. All right, so I will pause here and for questions.
All right, thank you everyone for attending our training this afternoon. We really appreciate you spending your afternoon with us and learning more about GGRC's services. A big thank you to Jayashri for providing all this information. Big thank you to our Spanish interpreters. And as a reminder, we will be sending out a follow-up email tomorrow with the presentation and materials from this training. Okay, have a good evening, everyone. Thank you.
Thank you.